You're listening to a brief excerpt from Bold New Approaches in Hospital Infection Control, co-sponsored by DNV GL Healthcare. During this webinar, officials from Piedmont Healthcare System in Atlanta and Upstate University Hospital in New York highlight exciting new strategies to control hospital-acquired infections.
Welcome, everyone. I appreciate you all sitting in on this webinar. It's going to be some very interesting insightful information for you to really identify some of what other hospitals have been doing and accomplishing. Two extraordinary efforts, both of Upstate University Medical Center as well as Piedmont Healthcare, and the efforts that they've made with this dramatic impact to impact infection rates. With the scope of DNVGL globally, our purpose is safeguarding life, property, and the environment, and infections within the healthcare system obviously touch all of that in some way, shape, or form. And it's really kind of a prominent issue, something that we, as all hospitals, struggle with. Some better than others, others with more resources than others. But I think in general, looking at the cultural aspects of the organization, the level of awareness and attention, education of all staff members, and that level of engagement that they've got really lead to accomplishing what we're trying to work on, as well as ensuring that safeguarding life and the property and the environment. DNVGL has a global impact for what we do. Yesterday, being World Patient Safety Day, was just kind of a reflection for us, is that what we're able to do with hospitals all over the world, but mainly here in the U.S., and kind of what we've tried to accomplish. We do this through different ways, both through accreditation and a certification, but the different accreditation programs that we offer would be related to the CMS conditions of participation for acute care, critical access hospitals. We'll have hopefully psychiatric hospitals completed later this year. And then with respect to the multitude of different certification programs that we've got, we introduced a couple of years ago kind of a managing infection risk that we've now kind of titled Certification in Infection Prevention, because really it's one of the aspects for mitigating risk. Looking at some of the prevention methods and things that organizations are doing. I've recently been participating over the last probably year and a half on a national steering committee for patient safety. And our focus is to really introduce a national action plan. And one of the primary focuses for this is that as we tie this all together, accreditation, our requirements, looking at the quality management system, how are we going to apply and having our organizations apply this kind of action plan? And it's really going to be the focus on patients, families, and the healthcare staff that are caring for these individuals. And so with this, to really kind of highlight some of what our organizations are doing, I am so appreciative of both Piedmont and Upstate University Medical Center to highlight what they've done and kind of what they've accomplished, and can elaborate on really the methods that they applied, maybe even some of the pitfalls that they encountered, because we know this is not an easy task for any hospital. But enjoy what you're listening to, and we participate in kind of with the questions following their presentations, that we can kind of engage with them to really gain additional insight in how they've accomplished this. So with that, I'll turn it over to Liz and Paul. And you can introduce your organization, please.
Thank you very much. So Upstate University Hospital really is a two-hospital system. We have 715 licensed inpatient beds. We see about 37,000 admissions. Our inpatient length of stay is about 6.5 days. We have about 87,000 adult and pediatric emergency visits yearly, and we get about 330,000 referral ambulatory visits. And we are the only academic medical center in central New York, and we are a level 1 trauma center. Some of our specialties include pediatric ED, pediatric ICU. We have a burn center. We have a regional oncology center, designated stroke center, and also our community campus is a DNV certified hip and knee center of excellence. And that's us at a glance.
So going in.
Thank you for that, Janae and Michael.
Great, sure. So Piedmont Healthcare has 11 hospitals, and we have grown just over the last 3 years. We've doubled in size. So we've been in a very big growth pattern over the last 3 years. We also have a really large clinic. So we have 555 clinic practice locations. And you can see on the right there, just kind of to tell you the scope and size of Piedmont Healthcare, we have over 22,000 plus employees. Our clinic is one of the largest in the state, if not the largest now. It's 2,000 plus providers. And one thing to point out about Piedmont Healthcare is one of our hospitals in Atlanta is the highest acuity community-based hospital in the country. So we do transplants, ECMO patients, a huge transplant program, oncology, et cetera. So we have really, really sick quaternary care type patients in that facility, which of course really gives us a lot of opportunity to find different hospital-acquired infection reduction strategies. But just wanted to throw that out there. Although we are a community-based health system, we do have our Atlanta-based hospital has very high acuity. And I think if you look at us compared to teaching hospitals, we're like number 13 in CMI. So just for reference.
You've been listening to a brief excerpt from the Bold New Approaches in Hospital Infection Control webinar presentation. This webinar was co-sponsored by DNV-GL Healthcare and recorded on September 18, 2019. The full webinar included a presentation and panel discussion with officials from Piedmont Healthcare System in Atlanta, Upstate University Hospital in New York, and DNV-GL Healthcare on effective new strategies to control hospital-acquired infections. You'll want to be sure to watch the full 1-hour webinar video. To do so, use the link appearing now on your screen.